Innovarius Nice Therapeutics presents Amber, intervertebral disc disease, a case study, sudden collapse with trauma to L1, L2.
She can't really move around, she's trying.
We localized the lesion around L1, L2. Some of the suspected causes were a fibrocartilaginous emboli as well as a herniated disc. Surgery was one of the considered options, and the owner opted for a non-invasive cellular electroceutical therapy over the area. We treated the area over L1, L2 for about 30 minutes and used it as an electronic anti-inflammatory. Here we see a pre-exam in neuro where we can show that there's definite neurologic deficits. Here's lack of writing reflex. She also presented some deep pain, but minimal, if any, superficial pain and diminished reflexes. The treatment's simple. We basically treated, again, over the area of interest for about 30 minutes. And what we find is that gradually as the area warms and start reaching temperatures of 37 degrees Celsius and above to 41, we bring in local regional blood flow, oxygen, plasma-rich proteins. We stimulate the secretion of heat shock protein 70 and 27 through magnetic stimulation, and the results just speak for themselves.
So why don't you tell me what happened? So this is, we did one time, and then what happened right after we did it? She was down last time we saw you.
She couldn't do anything, and after a couple of days, she got better every day to where she was standing on her own and taking a few steps.
Excellent, excellent. So feeling a little bit more, and she's actually taking some steps now and feeling better.
She can stand for quite a while on her own.
We're having a hard time keeping her from just getting up and wanting to go. Yeah.
Wonderful. Well, so good. All right, so today we're going to do round two.
Round two.
Here we go again.
And her disposition is almost back to normal.
Excellent, excellent.
Yeah.
So that
She's
should
back to
hopefully
her
continue to
happy self.
improve. Excellent, excellent. So that's after one therapy. Can we watch her walk, I guess, or do what she wants to do? She wants to stand, right? She was standing.
She wants to stand.
Yep, very cool. They're on their own here.
Stand up here.
Immediately after this video, we treated Amber for another 30 minutes with our nice therapeutic sound wave device, and went out to the lobby and noticed she was immediately better. We saw the owner was holding her up with a towel, and we said, just let her go, let's see what happens.
Really? Yeah.
And here it
is. This is 5 days after the sound wave therapy. She just had her therapy today, so she's leaving. This is 5 days after her initial injury. Oh, wow. Oh, boy. Okay. That's really cool.
You know, it's really important to note that we didn't use any steroids in the management of this case. This is just Innovarius Nice Therapeutics doing what it does best, acting as an electronic anti-inflammatory for the treatment of IVDD. Wow.
Sure beats surgery. Sure beats surgery.
So she comes back and we treat her a third time, and here's what happens.
Okay, so quickly, this is week 2, this is the third treatment, right? We're doing the third treatment with the sound wave device, and what you got going on in there?
Let's see, she's been walking quite a bit. She stumbles on occasion, not much, and she's running now, chasing squirrels in the backyard.
Oh my God, that's awesome.
She is.
And she's what, a little stumbly still, right?
Still a little stumbly.
Still a little stumbly, but you'd say...
about 80%
wow, that's
of what
wonderful.
her capacity was before.
Wonderful. And we've just been treating up and down her spine there in the areas of injury, and she seems to be responding quite nicely. Oh, thank God.
Well, the results are quick. We treated her for another 30-minute session, and here's what happened right afterwards.
After her third sound wave treatment, and how long ago was she paralyzed?
It was on December 22nd.
December 22nd, and what is today?
This is the 5th of January.
This is the 5th of January, so she's had 3
weeks.
treatments over 2.5 weeks, I'd say, right? Wouldn't it be it?
Correct.
And now she's going to do the Bob Marley walk. She's going to walk out of our clinic, and come on, let's go, girl. What are you going to do for her, Al? Oh, yay! Amber, do the Marley walk. Oh, look, she got a little power. Come on, girl. You're doing the see you later. Bye, Doc.
I'll be right back in to pay you.
Oh, my God, thank you. You're going to do that? Come on, Amber. Let's go, girl. Let's go, girl. And another dog leaves the office under her own power. Yay!
Better, I mean, now than when I got in here.
Oh my gosh. Isn't that great?
That's amazing, Doc.
Yeah. Thank you, God. Take care.
The treatment lasts. She's been fine for a few years. NICE Therapeutics are non-invasive cellular electroceuticals for reduction of inflammation and return of normal function. The medical arts are changing rapidly. If you want to know the secrets of medicine, then think in terms of how energy, frequency, polarity, and vibration affect phase transitions of water in bodies on a nano and on a macro scale. Increased knowledge of phase transitions and their role in biology and how radio frequencies affect them are going to revolutionize medicine. What you saw here means nothing if it can't be reproduced in your animal hospital. Call us and ask us about our research licenses. We have an ongoing pain and neurologic study looking for animals with neurologic symptoms such as loss of function, pain, or anesthesia or loss of proprioceptive deficits. We're here to serve. NICE Therapeutics. Nice dog.